introduce myself. I am Quentin VanMeter, pediatric endocrinologist, board certified, and the president of the American College of Pediatricians. The origins of transgender theory go back some 40 plus years, and historically perhaps more than that. At Johns Hopkins Hospital, where I trained in my endocrine fellowship, Professor John Money was on the faculty, and he developed theories of gender identity. Gender previously was a term used to describe linguistic terms. Nouns either were male or female in various foreign languages. And he adapted it to the human being. Before that, the term gender did not apply to human beings or biology. So Dr. Money had theories. He was an experimenter of ideas without any particular constrictions of patient protection. And he worked with patients in the adult world as well as with infants, and that's where our program came in. We had patients there who were infants born with ambiguous genitalia, whose genders were then reassigned based on the best possible thought at the time to see whether or not it would fit them later in their life. The history of this program is short-lived because what happened in both the adult patients and the infants is that there were disastrous outcomes and no improvement in their care. So this was a background from which I came. It was 40 years ago when I started there as a fellow and went through the program, and it lay fallow in the United States without any medical centers doing any kind of critical gender issue treatments in children until more recently. The Harry Benjamin Society, as it was developed soon after Dr. Harry Benjamin passed away. He was a practitioner in the 50s who was one of the triumvirate of physicians, or scientists rather, who were noted sexologists. Dr. Benjamin passed away, and in his memory, the Harry Benjamin Society was started as a support group, but not a professional science organization. In the 1970s, this group, internationally located, provided individuals around the world with information on where they could have their medical treatment or surgical treatment as adults if they felt that their gender did not match their biologic sex. This Harry Benjamin Society is now known as the World Professional Society of Transgender Health, or WPATH. It is still an organization that is a society based on theory and social theory. It is not a scientifically based organization with credentialing required for membership, with training and certification. In the United States, from the end of the Hopkins program in the early 1980s until 2006, there was no acceptance in this country, in the United States, of transgender care for children. In Europe, however, in the Netherlands, Belgium, and Sweden, there were programs for adults from the early 60s onward, and then finally in 2000 in the Netherlands, they began looking at treating these patients as children. The basic fact is that there is no biologic basis to gender identity. It is purely a social behavioral construct. This is stated clearly in the DSM-5 and the Handbook of Sexual Behavior of the American Psychological Association, both tomes that are highly respected in the field of mental health. There have been subsequently several flawed publications attempting to show that there is some sort of biologic basis for gender identity in genome sequencing or in MRI scans of brains of adults. But these studies were very poorly designed, not scientifically controlled, and have been debunked by larger reviews. The fact is that oft-quoted 40% suicide attempt in trans children who are not offered social, medical, and surgical intervention is fiction. The study that published in this percentage did not differentiate between the children who were offered counseling only and those who were affirmed. The real suicidal ideation is no different in transsexual children than those with anxiety, autism, or same-sex attraction, essentially around 20%, and this is from the Williams Institute in California. Unfortunately, fear-mongering is a means used to promote bypassing psychological assessment of the patient, and the standard cry is, would you rather have a dead boy or a live trans female? The fact is that despite the suggestion of in-depth psychological evaluation proceeding according to what's called the Dutch protocol in the United States, the Zucker program, the concept of in-depth psychological evaluation and treatment is very important, and that 98% of the kids of the boys and upwards of 88% of the girls worldwide who believe that they are born with the body of the wrong sex as children go back to identifying with their biologic sex by the time they reach puberty and adolescence and complete adolescence. This leaves a small fraction of folks who are adults past the age of consent who then can make their own decisions and with their own physicians, adult physicians and endocrinologists and surgeons about if they want to continue treating their bodies and try to transform their appearance to that of the opposite sex. Despite the fact that in-depth psychological evaluations are recommended by the Endocrine Society and by the European groups that recommended those, the children in this country are going through treatments where they are bypassing psychological evaluation from the beginning. They are immediately taken in and medically transformed, initially socially transformed, and then offered surgical transformation, all before the age of consent. And this is happening across the United States. There are 18 states in this country so far, and the District of Columbia, which say that counseling ahead of this is no longer allowed. It's against the law. They have used the language calling the concept of affirmation as the positive way to go, and taking the child and allowing them to have in-depth evaluation of their mental conditions that are existing prior to the issue of gender identity disorder. They are calling that conversion therapy, converting a biologic person to the biologic person they are. And indeed, it's not conversion at all. It is maintenance of biologic sex, whereas the affirmation process is actually a conversion of the child's biologic sex to the identity of the opposite sex. Transgender affirmation advocates paint the proven effective counseling protocol as cruel or conversion. The academicians with contrary opinions in their academic institutions are let go from their positions. They are not published, and it's fear-mongering that keeps them from being able to make the statements that I'm speaking about today. The American Academy of Pediatrics, without evidence and support, states that psychological evaluation of gender incongruent and counseling of these patients is not indicated because it is cruel and unusual punishment. What the Texas Medical Board could do is to be the rational leader of a new movement that's occurring within the United States, and which has already occurred in Europe, in the United Kingdom, in France, in Italy, and in Sweden, where the medical professional societies who take care of these children and have overlooked the transgender programs there have taken it upon themselves to evaluate what is going on in their clinics. There has been an incredible increase in the number of children presenting as transgender. In 2006, when there was one transgender clinic in the United States, and that was in Boston, the incidence of transgenderism was thought to be 6 per 100,000 in males, 3 in 100,000 males and 6 in 100,000 females. Today it is estimated in surveys that up to 0.3% of children in this country are identified as transgender. That's essentially a 1,000-fold increase, if you will, in the incidence of transgenderism. It has nothing to do with social acceptance. It has everything to do with this being an industry that has been created for intervention and pushing children in a direction they do not need to go. What I'm asking is that the Texas Board be a leader of the country and ask for a pause in the process of taking these children and running them through our transgender clinics, which now number upwards of 50 in the United States, and allow the people that are doing this treatment to have a discussion with those of us who believe that affirmation is the wrong pathway and that counseling is the correct pathway, and put these side by side and evaluate with a panel of individuals that are balanced in terms of their approach, review the actual science, and come up with a program that is not harmful to children. Thank you very much for your time. Any questions for me?
I do have a question, Doctor. Thank you so much for coming in. Certainly it was eye-opening and enlightening to me and everybody else, I would presume. But would you kindly distinguish between affirmation and counseling?
Surely. There's two pathways as I view it. One, affirmation is social transitioning of the child in the preschool, primary grades and elementary, secondary education. Do it also in the family, teaching the family to accept the child's new found gender identity and to essentially affirm that conflicted gender is the actual person itself, and that's the direction that they should go. Secondly, affirmation is medical, so that before the child, or just as the child reaches puberty, puberty is stopped in its tracks. Now remember, puberty is what made the desistance of these children happen in upwards of 80+% girls and 90% boys. If they were allowed to go through puberty, they figured things out and came out at the other end essentially healed and in much better shape. A very small percentage go on to adulthood, and it does not seem to have helped them. So that is, if we're blocking puberty, we're taking away that ability to naturally solve the problem with counseling. And then the third thing is, after blocking puberty, giving these children cross-sex hormones. These are hormone levels that would be physiologic and normal in the biologic sex, but when they are given to the wrong biologic sex, the opposite biologic sex, we know from all the literature that has happened across the last 50, 60 years using these hormones and understanding endocrinology that there are harms, increases in cancer, increases in heart attacks, increases in strokes, and for those reasons, when adult women, for instance, are producing a lot of testosterone, the endocrine community and adult to this day fights tooth and nail to get rid of those high levels of testosterone because they are horribly damaging to the female body. So we are proposing with medical intervention that these hormones be given to the children when we don't know that there's any benefit at all other than changing physical appearance. And what we do know is there is an incredible harm in the long run to the adult. So it's an experimentation on children. There is no scientific basis which supports that it is safe or even necessarily effective in the long run. And that's, and the final part of the affirmation is surgical removal of genitalia, amputation of the penis and the scrotum and the testicles, removal of the uterus and the fallopian tubes and the ovaries, attempts to create a vagina structure-like structure in the male, and attempts to create a phallic-like structure for a female. And that is sort of the very long endpoint. Not all adults who suffer from this choose the surgical option, but affirmation starts with social, goes on with medical, and then ends up with surgical. Counseling is counseling. It's talk therapy. It is not aversion therapy. It is not conversion therapy. It is evaluating the psychological basis for which this child has used the concept of gender identity disorder or incongruence as an escape route from undercurrent mental health issues. And so that I would just say that if we are in a country that's not going to allow counseling to happen, we are essentially pushing everybody down the affirmation pathway to what is going to be lifelong therapy.
I just want to be very cognizant of time.
I'm sorry.
Any other questions? All right, great. Thank you very much.